welcome to Proactive Prudence. In this video, we'll be studying about pathology and the first chapter, which is Introduction to Clinical Pathology. So, clinical pathology, what is pathology and where is it derived from, and the definition of pathology, we'll study about it. So, pathology is derived from two Greek words, meaning which are pathos and logos. Pathos meaning suffering and logos meaning study. So, the definition of pathology is the study of scientific changes in structure and function of the body in diseases. So, when the body is diseased, we'll be studying the structural and function of the body, how it reacts to the disease. That is called as pathology. Moving on to clinical pathology, the definition of clinical pathology is analysis of various fluids, including blood, urine, semen, CSF, and other body fluids is included in this branch of pathology. Such analysis may be quantitative, semi-quantitative, or qualitative. So it's qualitative. So the definition, I'll read it out again. Analysis of various fluids, which includes blood, urine, semen, CSF. Such analysis may be quantitative, semi-quantitative, or qualitative. Moving on. The tools used in clinical pathology are microscopic examination, physical analyzers, cultures, values like normal value and the abnormal value. So macroscopic examination is a physical examination that you make by looking at the specimen or the sample that is obtained. That is called as macroscopic examination. And microscopic examination is observing under microscope. And physical analyzers are used to physically analyze the specimen obtained from the human body. And cultures are growth of the bacteria or any microbes that is present in the human specimen. And values indicate what are the normal values, like blood count, RBC count in blood, and abnormal values of RBC is seen under values. Moving on. So why do we need to study clinical pathology? I have listed down some certain points to why we have to study clinical pathology. We will go through each of them. Being familiar with the structure of a general laboratory in a public hospital, it helps the student to learn about the structure of the general laboratory. So the basic understanding of health information system or laboratory information system, like reception and reporting sections. You'll have the basic knowledge of how the health information system works, or the laboratory information system works, how the reception and reporting sections work. Moving on, it helps in the basic understanding of laboratory errors and their causes. What are the lab errors that is being made can be understood by the student. Then the basic attempts in specimen handling and being familiar with the special anticoagulants, like how you learn how to handle the specimen that is being obtained, and what are the different anticoagulants that are used for the blood in order to prevent coagulation or clot formation. So moving on, basic approach or tests in clinical microbiology section. So what are the basic approaches or the tests that is being conducted under microbiology? So then how you'll learn how to do gram staining and examine the slides under the microscope. The most important in clinical hematology and fundamentals of instruments. What are the instruments that are being used in clinical hematology? We'll be studying about that in clinical pathology. Moving on. Next point, how to prepare peripheral blood smear, and how to examine the peripheral blood smear under the microscope. Then the clinical biochemistry section and an auto analyzer workout. We'll be studying each of them in different videos. For now, we'll see what are the importance of clinical pathology in day-to-day studies of a student. Then the basic approach to an emergent test and a critical value. So whatever the test that comes, whatever the critical values that come to the lab, that how are you going to handle those reports, how are you going to approach it, that is being learned under clinical pathology. Then basic rules in blood banking, concept, different tests and forms, types of products. So what are the rules that are followed in blood bank, that will be studying under clinical pathology. Then basic tests in parasitology and urine analysis, basic concepts and tests in hormonal assay, then immunology and serology. So what are the hormonal assay, immunology, what is the immune system, how does the immune system working with by studying the specimen that is being collected, and also the serology. Moving on, the basic rules and statistics in quality control of different sections and quality assurance. So this ends up the video on introduction to clinical pathology. In next video we'll be studying about collection, transport, prevention, preservation and processing of various clinical specimens that are obtained. So stay tuned till the next video is uploaded. Thank you.